Hello, it's Dr. Hafsa here. Today, I will be breaking down a topic that many people find scary: appendicitis. So let's get started. Appendix is a thin tube roughly the size of a finger and it is joined to the large intestine. It sits in the lower right corner of your abdomen, as you can see over here, and this appendix, when you are a child, works as a part of your immune system and helps your body fight diseases. The appendix can get infected sometimes, and if this is not treated timely or within 48 to 72 hours, this appendix can rupture and this leads to spread of bacteria from the inside of your bowels or the gut to the outside into the abdominal cavity, leading to peritonitis. There are many causes of appendicitis, and here I will be discussing a few. Hard calcified fecal deposits, known as fecalates or appendix stones, can get stuck in the opening of the appendix, and when this happens, the appendix gets completely obstructed, and here is the point where the infection in the appendix starts, leading to appendicitis. Other than this, whenever you have any infection or inflammation in your body, your lymphatic system, which is a part of your immune system, helps fight infections by releasing white blood cells. And as a response to the infection or inflammation, the lymphoid tissue swells up. This lymphoid tissue is present in the appendix, and when this happens, it obstructs the appendix, which leads to infection inside the appendix. Colitis or the inflammation of the colon can also lead to appendicitis because, as we discussed, the colon is attached to the appendix. Tumors and parasites can also lead to obstruction in the appendix, and this will eventually lead to appendicitis. Cystic fibrosis is a disease in which the body produces a sticky and thick mucoid secretions, and when this happens, these secretions become a reason for the appendix to get obstructed, which can again lead to appendicitis. Sometimes other conditions can mimic the symptoms of appendicitis, like pancreatitis, urinary tract infection, inflammatory bowel disease, gastroenteritis, intestinal obstruction, pelvic inflammatory disease, endometriosis, ovarian cyst, and kidney stones. Here are a few signs that are used by the healthcare providers, and you can also use them at home to see if anyone around you in pain has appendicitis or not. The first one is Blumberg's sign, in which pressure is applied to the sore area, which is generally right lower quadrant or the right lower corner of the abdomen, and when this pressure is released, the pain becomes worse. This is also known as rebound tenderness. Dunphy's sign, in which coughing makes the pain worse. Rovsing's sign, in which the pressure is applied to the lower left side of the abdomen, and this produces pain on the lower right side of the abdomen where the appendix is located. Sauce sign, in this the right hip is extended, as you can see over here, and if the appendix is behind your colon or in a retrocecal position, the appendix might irritate the psoas muscle, and this exacerbates the pain and makes the pain worse. To treat a patient who is suspected of having appendicitis, the first thing you need to know is that almost everyone will need antibiotics for appendicitis. Antibiotics are a standard preventive treatment before the surgery, and they are given regardless of whether you have surgery or not. But if you have a very early or mild case of appendicitis, your healthcare provider might take the wait and watch approach, in which you will need pain relief medicines through the intravenous route. But once you have been diagnosed with appendicitis, you need to have an appendectomy within 24 hours, because within 24 to 36 hours from the onset of the first symptom, the appendix can rupture, and this can lead to peritonitis, which is an emergency. And nowadays, laparoscopic appendectomy is done worldwide. If this video was helpful, please give it a thumbs up and subscribe for more content like this.